Good evening, dear Medyascope viewers. Welcome to This Week in Turkey. This evening, our guest will be Dr. Özlem Kurt Azap. Dr. Azap will be joining us to speak about the sharp increase in positive coronavirus cases across Turkey, the controversy surrounding the data provided by the Ministry of Health, and further precautionary measures to take in the ongoing fight against COVID-19. First, let's take a look at the coronavirus-related developments of the week. Regardless of the warnings made on increasing the precautions and hygiene measures during the Eid holiday, masks and social distancing measures were violated in many marketplaces and holiday destinations. As a result, Turkey followed a serious increase in coronavirus cases.
As of 1st of August, the number of daily coronavirus cases in Turkey exceeded the number of daily recovery. The country's new coronavirus cases surpassed 1,000 for the first time in 3 weeks on 4th of August, breaching what the government has called a critical threshold to possibly reconsider rules. The Minister of Health, Fahrettin Koca, had given a verbal warning before the Eid vacation started, saying that, let's take the situation so seriously during the Eid al-Adha holiday that after the vacation, no one should stress over the number of cases. However, images from the holidays reveal that the situation is not getting better. Member of the Board of Science, Professor Dr. Hasan Tezer, has shared his views and observations on what has been happening during the days of the holiday on national television. Unfortunately, there was an intense amount of touching and contact among people. Even though people were using masks, we have seen that they were not worn in the proper manner. Considering the traditions that the Eid al-Adha celebrations bring, the crowd and the lack of attention put on practicing social distancing has been a serious contributor to the rising number of cases. For instance, the animal marketplaces to purchase a sacrifice have been extremely overcrowded, and the holiday visits to family elders done without using masks or practicing social distancing have been very common. Even though there was a legislation published in the previous months regarding the procedure that needs to be followed in the sacrifice services, many surroundings of the animal marketplaces and residences in Istanbul became illegal slaughter locations. During the vacation days in Istanbul, many have gone to the Prince Islands and Şile, a district of Istanbul, where they stampeded through not obeying social distancing measures and mask usage. People who took their vacation leave raided the Aegean and Mediterranean beaches. Following the reckless chaos among the country during the 4 days of Eid holiday, the planes arriving to Istanbul from various domestic flight points were also spotted to be extremely crowded. Furthermore, the airport personnel had to frequently warn and remind the passengers to not take off their masks and to practice social distancing. Due to the sharp rise in numbers, the government on August 4th adopted daily quarantine inspections, new tracing oversight in all cities, and measures for weddings, funerals, and other large gatherings, even while it avoided broad curbs on economic activity.
The Turkish government is planning on reopening schools nationwide on August 31st. Schools have been conducting online education since March when the first virus was detected in the country. Now they're planning on reopening in-person education under the health and safety guidelines determined by the Ministry of Health.
According to the circular that the Ministry of Education has issued to all 81 cities, schools in Turkey are to reopen on August 31st and are to close on June 18th, 2021. Regarding the topic of safety of reopening the schools, Ministries of Education and Technology have been collaborating on certifying schools based on their hygiene standards. According to this certification, the schools who abide by the set of hygiene guidelines that have already been set out by the Ministry of Health will receive a My School is Clean certification. This guideline covers hygiene measures beyond the classroom, such as school buses, playgrounds, labs, and prayer rooms as well. In order to ease the panic that the news has caused to the public, the Minister of Education, Ziya Selçuk, commented, "If the conditions are still suitable by the end of August, we will proceed to open. However, if not, we are fully ready to provide online education or a hybrid system that works with both. We have closely examined the essential pedagogical principles and health conditions to create a learning environment, and we take the precautions necessary to provide them to students." In line with the data provided regarding the number of coronavirus cases, the date given for reopening schools will be re-examined and redetermined on the basis of how the country is handling the pandemic by the end of August.
This evening, our guest is Dr. Özlem Kurt Azap. Dr. Azap is a member of the Turkish Medical Association and a doctor at the Department of Infectious Diseases at Başkent University in the Turkish capital of Ankara. Dr. Azap, thank you so much for joining us this evening.
Hi, thank you very much for your invitation.
So I remember you were one of the first medical professionals that we interviewed back in March for This Week in Turkey when the first coronavirus cases appeared. Now we're 5 months later and our daily confirmed cases have exceeded 1,000 officially. And we'll talk about the numbers in a bit. But to begin with, Dr. Azap, what stage of the pandemic is Turkey in at the moment?
In fact, the numbers are probably higher than April. So, as we all know, the highest numbers were seen in April in Turkey, but nowadays our observations show that we see more patients than April. So we are at the center of the pandemic, I guess. You know, the first wave, it's frequently asked, when will the second wave will start, or has the second wave started? They are the most commonly asked questions, but I can easily say that the first wave hasn't finished yet. So I guess we are seeing the second heel of the first wave. The first heel of the peak of the first wave was in April, in mid-April, but now we are facing the second peak of the first wave. So what's the important part of this, but why we are talking about this? Because we hadn't completed the first wave. The normalization efforts were done in assumption of the decreasing number of cases, but in fact they were not decreasing enough to start a new normal. After 1st of June, the numbers increased gradually, and now we face the second peak of the first wave, I guess.
Yes, you're mentioning the numbers. Indeed, the Turkish Medical Association has said that the number of daily coronavirus infections only in Ankara amount to approximately 1,000, thereby disputing the official figures, which put the daily nationwide tally at around this level. And you know, doctors in Ankara, again, where you're located, are saying that the pandemic hospitals are running at full capacity. Another statement was made by the mayor of Adıyaman, stating the same thing, which were then refuted by the Minister of Health, Fahrettin Koca. Now, there have been some serious issues relating to the lack of transparency of the Turkish government in its management of the pandemic. Just last week, for example, 2 significant parameters have been removed from the chart shared daily: the number of patients in intensive care units and the intubated patients. So what can you tell us about the official numbers of the ministry with the data coming in to the Turkish Medical Association?
As for the management of the outbreak of the pandemic, the first principle is transparency, of course. But from the beginning of the pandemic, the transparency couldn't be installed by the Ministry of Health, I'm afraid, because the numbers were not similar with our observations. First of all, now when we look at the March and April, the more than half of the cases were in Istanbul. So we were not, for example, in Ankara, we were not aware of the number of cases so much, because as the Minister of Health said, Istanbul was Wuhan of Turkey, was the epicenter of Turkey. So we were saying that, no, we don't have much cases in Ankara. So we were prone to believe what is said at that time. I guess the numbers were true at that time. But now, from all over Turkey, we are hearing some news. For example, even when we count by our hands the patients, we see that it's more than the reported ones. You know, they are saying that it's almost 1,000 all over Turkey, but when you count from your friends' news, it's, for example, in Ankara, it seems more than 1,000. So what's happening in the other part of Anatolia, in Istanbul, in Izmir, what's happening? This really disturbs both the public but also the healthcare workers, because what we see is not what we hear from the official numbers. So, you know, also about the healthcare workers, we don't know the number of the infected healthcare workers, and we are now very exhausted and really very tired and anxious. The number of the cases of healthcare workers are also increasing in parallel to the increasing numbers. So transparency is important in both aspects, from the public health view and from the healthcare workers managing the pandemic, trying to manage the pandemic. I think in the coming days, we will hear more cases and the numbers will also increase officially, but even at that time, it won't be the numbers we see. I don't know how this will be solved. This is a problem, really. This is a problem. I'm not sure how it will be solved by the Minister of Health, because as TMA, Turkish Medical Association, we are trying to count the numbers city by city, but of course we don't have the real numbers, because the doctors also are both busy and a bit afraid of telling the numbers from their hospitals. This also, even we can't get the real numbers, still the numbers we get are higher than the reported ones.
Yes, I mean, I remember throughout the pandemic, there have been several medical professionals who have kind of come out and, you know, in an outcry stating that, you know, the numbers are higher, and they were forced to apologize in that sense. But it seems kind of inevitable that these numbers will increase, as officially, while, you know, Minister Koca is tweeting that we should be careful in terms of our hygiene, you know, social distancing and wearing masks. On the other hand, on an institutional level, there are these, you know, the grand opening of Hagia Sophia, tourism is being encouraged, and now we're talking about reopening schools in just 20 days. So what are citizens supposed to do? Is it really something that can be prevented, the spread of the virus can be prevented on an individual level, or is there like a real dilemma here in terms of the message given out and the precautions being taken?
Of course, individual precautions are very important, but if you organize a meeting and thousands of people come there, it's not possible to keep individual precautionary measures. You gave the example of Hagia Sophia, and it's really unbelievable. The people didn't, of course, protect the physical distancing, and they also gathered all together. Many of them didn't wear masks, and also not only masks are protective. Hand hygiene, for example, they touch everywhere, and thousands of people did this. So individual precautions are not enough to control the pandemic. In fact, the pandemic can only be controlled at governmental level and by a central approach dealing with the people at institutional levels. I mean, about schools. Now the numbers are rising sharply. If schools are opened, we will of course face more cases, because it's not easy it's not easy to keep the children taking precautions at schools. And one of the successes of Turkey's management in pandemic was the closure of the schools at mid of March. Really, it was an early attempt to control the pandemic, and it worked, I guess, because yes, children are not don't have serious illnesses, but they are unfortunately very good wishes to transfer the disease to their families at home. And of course, to their grandmas, grandpas. You know, in Turkey, there are many families living with their grandparents and as big families. So to open the schools, we should be able to say that, we should be saying that the pandemic is under control. Is it under control? No, it's not. It's obviously not under control. So I really believe that schools are important. Students are bored, parents are bored, they are anxious about their future. They are all very important. As a parent, I of course prefer sending my children to school. It's obvious, but if all schools are open and all students are sent to schools, the problem will increase. These sharp increases will be more prominent, and the risk, the population at high risk will be really hurt by this attempt. I hope again the numbers of the cases will be evaluated, and maybe a new decision can come out after this evaluation.
And also, if, as you were mentioning earlier, transparency is very important. So if the numbers were perhaps more transparent, more regional precautions could be taken. So for instance, in Istanbul, perhaps schools would stay closed, but somewhere else in the country where cases are very low, perhaps a slow opening could potentially be done. So it wouldn't have to be just one policy across the nation.
Yes, it's a very important issue. From the beginning, we have been saying that the precautions should be implemented at local levels. This local level will change based on the numbers. For example, Istanbul is a city, but the other cities were not in parallel with Istanbul in March and April. But now many cities are facing similar problems. We can use our experiences to solve the problem. It has been for 5 months almost. We are dealing with this pandemic, and we have really good experience about some issues. So we can use them. As you said, the schools may be closed in Istanbul, but opened in Ankara, for example. And it can change during the coming months, because this pandemic will not end in a short time. We will be facing with these cases for a long time, at least a year, at least, and maybe more. So we have to be progressing in a controlled way and with transparency. This transparency should include both the numbers and the precautions taken. So if the ministry doesn't get the acceptance of the public and healthcare workers, their job will also be more difficult. If this management should be done with transparency, they would deal easier with the problems. Now they are also trying to make the people believe them. They are trying to pursue the people. It's not easy to make the community pursue about their acts. So pandemic is a very difficult, these times are very difficult times, but to make these times easier, we should be more transparent and more trustable at institutional levels.
And as you said, Dr. Azap, I mean, we can really see the public also kind of relaxing or just giving up the fight, you know, especially in these images that we've seen on all the Aegean and Mediterranean coast over the last, over the, you know, holiday period. So, and again, I feel like you mentioned it again earlier, that we have to remind people that medical personnel have been working nonstop since March, and you are exhausted, and it has this, takes on a personal toll. So we have to kind of realize that we're taking on, we're responsible for you in that sense as well. You mentioned that schools should probably not open, but in the next couple of weeks at least, what would you recommend in terms of reevaluating the steps of normalization?
Of course, I also want to add that the problem of influenza and other common viral disease are coming with the coming of the autumn. So we have to organize precautions both for COVID-19 and also for influenza and other respiratory diseases. So the crowded populations in the closed doors, in the closed rooms, are the most important risk factor for spread of disease. So we are trying to mention that if we get relaxed both during the holiday time and also in our routine life, we will face more prolonged periods of difficulties. You said that during the holiday time, almost nobody obeyed the rules of precautions for prevention of COVID-19. Even at the restaurants, everybody was sitting very next to each other. If you see that scene, you can think that COVID-19 has never happened. But when you come back to real life, got 900, it's not much, they were thinking, I think, because I can't explain in other ways of this relaxation. And for the coming months, we will be careful both about COVID-19 precautions and about other disease. For example, influenza vaccination is very important to prevent the influenza-related diseases and maybe deaths. We have an important scientific article from Brazil. They are now in the influenza season because they are in southern hemisphere. So in Brazil, they showed that if people get vaccinated for influenza, it also indirectly protects against COVID-19. Because there are mechanisms explaining why this happens. And it's a scientific research, scientific article. So we should be prepared for vaccinating all the people for influenza. For example, before this, we were saying that influenza vaccine should be used for high-risk population. But in the COVID-19 era, we can easily say that no separation for risk groups should be used. I mean, everybody should be vaccinated against influenza. In case of the schools opening, even the students should be vaccinated against influenza. So I hope the government has prepared enough vaccine supply for this. We didn't see any proof for this, but they say that the Vice Health Minister also said they are preparing for the influenza season. But we want to see the numbers. For example, how many vaccines has Turkey bought? Last year, we experienced a bad time for this because we couldn't get influenza vaccine till November. So it was too late to get vaccinated. This year, we don't want to face the same difficulty. So maybe the easy part is for the prevention of both COVID-19, influenza, and other common respiratory diseases, we will do the same things as individuals with the masks, the hand hygiene, and physical distancing. This is the easy part. If we obey these rules, we will be protecting ourselves and our belongings from all diseases, almost all diseases we will face.
Yes, and for the vaccine, Dr. Azap, you mentioned that November was too late. So when is the good time to get vaccinated? Is it September, October? What is your suggestion?
At the end of September, and at most at the beginning of October, because we need almost 2 weeks for the vaccine to work. I mean, if I get vaccinated today, I will have the protective antibody titers 2 weeks later. So we not later than the beginning of October. It should be before the beginning of October to be ready for the mid of October.
Dr. Özlem Kurt Azap, thank you so much for joining us and for sharing invaluable information.
Thank you very much. I wish everybody a very healthy autumn.
Thank you. You too. Thank you. Turkey's consumer price inflation surprised with a bigger slowdown than anticipated, falling to 11.73% year-on-year in July, official data showed on Tuesday, reversing 2 months of rising inflation.
Price growth slowed in July for the first time in 3 months as the economy emerged from coronavirus restrictions, helped in part by the effect of last year's high base of comparison. Inflation edged down to an annual 11.8% from 12.6% in June. A group of 15 economists polled by the state-run Anadolu Agency on July 29th predicted annual inflation would drop to 12.03% in July. The economists also predicted a 0.82% monthly increase in the consumer price index, with estimates ranging between 0.3% at the lowest and 1% at the highest. The government's year-end inflation target is 8.5% for 2020, as laid out last September in its new economic program. Turkey's central bank, which has held its policy rates at 8.25% since June, citing rising prices, last week revised its year-end inflation forecast to 8.9%, up from 7.4%. Meanwhile, the Turkish lira on the 6th of August hit record lows against the dollar and traded at 7.27 per dollar at 1 p.m., losing 3% of its value. Previously, it hit a record low of 7.269 per dollar in early May.
Demonstrations in support of the Istanbul Convention were held across 16 cities in Turkey simultaneously on August 5th. Women across the country gathered under the slogan, "We are not giving up on our rights, implement the Istanbul Convention." During the protests in Izmir, police battered and detained several of the women.
Hayatımız! Hayatımız!
In response to the public debates about whether Turkey should withdraw its signature from the Istanbul Convention, thousands of women rallied on the streets in various parts of the country. During the last protests held in the Aegean province of Izmir, demonstrators faced violent police response as several were battered and 16 women were detained. As some of the women resisted being detained, one of the police commanders was heard instructing his colleagues to break their arms should the protesters defy the police. The women who were detained were later released. Rights defenders say that the Istanbul Convention, which is an international human rights treaty against domestic violence and discrimination, is important for women's protection in a male-dominated society, but some of the officials from the ruling Justice and Development Party have claimed that the treaty undermines family values.
Muharrem İnce, a former congressman and presidential candidate for the CHP, is allegedly planning to found a new oppositional political party. The allegations state that İnce has told his close circle about founding the new political party by the new year.
Over rumors that came from the pro-government Hürriyet newspaper's journalist Yalçın Bayar on the 1st of August, Muharrem İnce tweeted the following day to clear up the air. In his tweet, İnce stated, "I have not spoken to any media outlet or any newspaper during this process. I will explain myself after I decide if what I am doing is right for my country." While the allegations remain unconfirmed, the rumors have been swirling among Turkish politicians, commentators, and of course, among the public. Medyascope carried out an exclusive street interview with the public on the 5th of August, asking their view on İnce's possible new party. Almost all opinions were negative and unsupportive of a new oppositional party ran by İnce. One of the street interviewees stated that, "I am not a supporter of Muharrem İnce's plan to establish a new political party because I believe that this move will harm the main opposition party, CHP, and this harm will reflect as a benefit for other parties." The allegations came right after CHP's regular Congress, where Kılıçdaroğlu, the incumbent leader of the party, was re-elected as party chair for the 7th time. Currently, İnce does not hold a formal position in the CHP, as he had to resign from being a congressman to run for presidential office, which he lost. Additionally, the way he handled his loss in the 2018 presidential election disappointed his constituents. İnce has lost the confidence of many of his constituents when he abstained from giving a speech and instead texted a journalist who made the announcement to the public that İnce had lost the elections on the night of June 24th, 2018. Regarding this topic, Medyascope founder and editor-in-chief Ruşen Çakır has stated in his exclusive broadcast on the 4th of August that he does not think that such a party formation is necessary for the time being. Inside the main opposition party, there are people who lost hope for Kılıçdaroğlu, but I doubt that they are looking for alternatives or replacements. Even if they are looking for alternatives, I really do not think that Muharrem İnce is the alternative they are looking for. Personally, the most important reason behind this is the night of June 24th. If that night İnce was to go in front of cameras and take the defeat in front of the public, presumably Kılıçdaroğlu would have to hand it over CHP's chairmanship to him one way or another.
Yeni bir seçime şimdi tekrar başlıyoruz deyip bir çıkış yapsaydı.
That's all from This Week in Turkey. See you next Friday at 9 p.m. Good night.